Ooh. Oh, fuck.
Keep moving.
Well, that was a good one.
See, man. How you been feeling? They said you noticed you started getting a little stiffer.
Yeah, definitely been getting a little more stiff. But it's mainly in my upper back and then in my lower neck, obviously.
Okay.
I mean, I can still look up at the sky.
Good. All right. Yeah. We'll make sure you.
See, he's not like last time, right?
I mean, it still hurts a little bit. It gets more stiff over time, but I have
Remind me about what your posture looks like nowadays. Looks like. What are you doing?
like this.
Mostly. Do you work seated?
No, I don't work seated. I'm outside standing 90% of the time. So.
Okay. But just when you're home, relaxing, kind of more seated at home.
Yeah.
All right. Any pain when you turn your neck left?
No.
A little restricted there. Turn your head right. A little more that way. It's a little bit more difficult.
I do notice that now. Ever since I came here, I start to look this way. And I'm like, I can't go as far on that side.
We're gonna check that at the end, though. And then go ahead and just look at your posture a little bit. See, keep staying straight. Yeah. All right. Head's a little off to the left side. Looks like a little bit. All right. So what happens is it's like when the head translates left. Essentially, it's like you're in right tilt. So your head's basically always going to the right, which makes it easy to turn to the right because your neck's kind of always going that way. Mm-hmm. And then when you go to the left, you have to go back to neutral, and then it's like a farther distance to get to the left. So what I'm looking at, it's like your head is actually translated to the left, which opens this left side, compresses the right side. All right, let me have you on your back for me. All right, let's see how your back's moving. Cross your arms for me. Bend both the knees. Let's get your back moving. Take a deep breath in, a little sit up. Let all the air out. Let it go. Keep going, keep going. Okay, deep breath in. Head back. Let it go. There we go. One more. Yeah. A little tight. Exhale. Chin down a little bit. Nice. Oh, got that top one. Yeah. Got them all. Hands around your belly. Take a deep breath in for me. Look over this shoulder a little bit. And then deep breath. Exhale. Let your back relax. I got you. Exhale. Oh, there you go. Very nice.
That will hurt.
And then deep breath. Exhale. Twist. Exhale. All right, good. Face up for me. Yeah, it's like his neck wants to get away from this left side, and then the right side is all compressed. All right, let's rub this up here a little bit. You said you're just fishing a lot. What else? And working a lot.
I mean, work is fish.
Okay.
For the most part right now. I ended up getting my captain's license.
Nice.
Yeah.
All right. So no particular game you're playing or anything?
No, not really anymore.
I'm playing way too
Try
much.
to stay away from it.
I'm still in D2, Diablo, and World of Warcraft, unfortunately. So I always come back. Usually a private server.
Yeah, I eventually come back.
I can't help myself. I'm gonna get this left side to compress a little bit. I got your head. I promise I won't hurt you. There you go. Here we go. All right. Here we go. Easy. All right. We'll go deeper in a second. I'm just gonna loosen it up first. There you go. There we go. Nice. Yeah. Your neck doesn't like to tilt left. That's what I saw when you were standing and I asked you to turn your head left. It doesn't want to, this side doesn't like to compress, so you're in right abuse. So try to, if you catch yourself sleeping always on the right side.
I wake up some nights and my neck is killing me. I'm like, I don't know, maybe I'm sleeping wrong or
are you
wrong.
Are you a side sleeper, you think?
Yeah, 100%.
Yeah, try to be not on the right side if you can. Maybe for a couple weeks or what.
Side.
Try to be on your left side. That'll actually correct that a little bit. My dad calls it feeding the monster. You feed the monster by going to the right, the side that you're already drifting to.
You got the scraper.
Not the scraper. Wow, I mean, just from the first time I felt your neck to now, it's like not even close to the person your neck used to be.
Yeah, it definitely feels a lot better now.
It's like, whoa. His neck doesn't want to go back at all. there's a willingness. It's like a drawer, like a piano key. It should just, have no resistance. It shouldn't be like fighting me. Like a door hinge, it's all rusted and frozen.
I'm glad I figured that out now,
Yeah.
because now I look up at the sky and I'm like, oh, I'm fine still.
Right. Let it go. I got you. There we go. Relax here. Here we go. Oh, fuck. Keep moving.
Well, that was a good one.
When you're ready, turn your head left. Yeah. Good turn.
Why did it move that much after? That was.
It was frozen. Your neck is like essentially it's like this, so that won't compress on that left side. We gotta try to be on that, sleep on that left side. Avoid that right
When you
side.
do that, you can feel that
Yeah.
Yeah.
in your head.
Yeah.
Yeah, that washboard right here. We want to push all those ribs down. We actually start to recruit the upper back. When the upper neck is tighter than it's supposed to be, we actually utilize our upper back to assist in turning our neck. We'll actually use these areas to help turn our neck when they're not even designed to do that. We're supposed to turn our neck with our neck, not with our upper back. And so
How do you do that? How does your lower or your upper back turn your
it gets
neck?
recruited. It gets recruited. Yeah, you'll see. Like I always joke with Larry King. You're turning your shoulders because your neck doesn't turn properly. So if you look up for a second, right? If I can't turn my neck, I'll do
Oh,
this.
Yeah, I definitely noticed
right.
myself
So
doing that.
this is recruitment.
Yeah.
I should just do this,
Yeah, you should turn all
but
the
I
way.
can't. So I'm gonna use my chest
I
to help
definitely
me.
I definitely noticed doing that.
And that the extra use that you're utilizing your upper back to help you turn your neck torments these vertebrae. And essentially the ribs just stay in the up position. They're like, well, I guess they're to keep asking me to do a job I'm not really meant to do. I'm just going to keep doing it. And then the muscles get really tight and everybody wants to just rub the spasms. And I go, guys, it's a recruitment problem. If the upper neck, which we just got moving, does its job, then this area will go back on vacation and it won't keep being recruited. Anyway, that's there we go.
Why does that feel so much different up there?
Yeah,
Like, it feels crunchy.
correct. Yeah, it's that you probably going back to when you're 16, and then also like I'm talking about with the neck. your head's tilted to the right, so it pops all these ribs up on the left. Right, so this has to do with that left side of your neck wanting to be avoided. It then mirrors and dominoes down to your chest and then even down to your feet eventually. But
My feet.
well, yeah, it causes domino effects, right? So then you're tilting this way, which then puts extra stress here, which then throws the work to your left knee, and
Really?
it keeps ping ponging down to your toes. Just like tires on our car, if your tires aren't on straight, you wear your tires out unevenly. We don't have any alignment specialists and too many symptom doctors, too many illness care, reactive care doctors that aren't concerned with, for instance, even the nerves that leave your back go to your organs. The nerves that go to your stomach come from in here, and so you can have indigestion or what they might call gastric paresis because you have too much inflammation in this region.
Really?
Yeah. So the nerves, the celiac plexus is the bundle of nerves behind your stomach, and those are supplied by wires that leave your upper back. And I can't tell you how many people have so much soreness in here, and I had a 19-year-old girl pole vaulting girl. Her stomach, wasn't digesting food after, her competitions, and they went to the hospital. They decided to do a Botox injection into the wall of her stomach. Now, how that was going to restart her stomach, I have no idea, but...
How did that even work?
Right, but they spent $3,000 injecting Botox into the wall of her stomach. She came in to see me. We worked on her upper back, got her upper back. She had a tremendous amount of soreness in her upper back here. And as we got her upper back clean, very quickly at 19, she could eat, not throw up. It's overlooked that the nerves from our brain to our bodies, how the body's controlled. And so if the nerves from our body are inflamed,
Well, I have been getting heartburn recently.
Right, well, it's connected to the more forward your head goes, the more pressure's on your stomach.
Huh.
Right? So the stomach is underneath the bottom of your sternum, and the more we sit, especially after eating, you want to go for a walk, not just to help digestion, but also to help stop squeezing the stomach right after you fill it.
Mm-hmm.
And so the antacids, or the proton pump inhibitors they give you as medication, doesn't stop the reflux, it just neutralizes the acid, right, or diminishes the acid, so your reflux no longer burns, but you're not stopping the reflux.
No means that I think the neck was connected to the stomach.
That's right. Yeah. Well, there's, believe it or not, a nerdier group of chiropractors that all they talk about is forward head posture. That the more forward your head goes from your shoulder, the myriad of problems that are the result. Gastric reflux being one of them, hypothyroidism, nerves that go to your thyroid get aggravated in your lower neck. So you can look like a nerve chart and you'll see that at every level there's wires that leave your spine, and
They go all over the place.
they're all going all over the place, right? And so if the nerves are aggravated right as they leave, I call it this little channel or a gutter that runs alongside the spine is one of the most common choke points. It's like a funnel that the nerves have to get through to get out to the body, and it's the most common site of impingement, aggravation, irritation, and so that's why we focus on the spine and clean the spine. Its mobility is what washes itself, and so when we have injuries, you fall when you're 16, your body expects you to fall again, so it puts up tightness and protection. Right, and part of
Stiffens it.
it stiffens it up, right? So part of our treatment is to take away some of that protection. Now, if you want to fall again, it's probably better that you keep that protection. I wasn't planning on it, Ed. We want balance and the whole spine to work as a team.
Well, I don't plan on hurting myself anymore.
Correct, yeah,
so-
right. It's not on my schedule, Ed. At
least I hope not.
Right. I hear you.
I am pretty accident prone though. I've had my fair share. Got a story. So the other day, we were fishing here on the boat, and we got into a little bit too shallow water. The boat got stuck, obviously, so we had to push it. We're pushing it from the back of it, and immediately I get like this super sharp pain in my back, like bad. And then for like the next 2 days, there's like a super sharp pain in my back. I felt like a pinched nerve. Is that possible?
You think it was more up here or down here?
No, it was in like the center,
Up
down
here,
there.
Yeah, you pop these ribs out. Yeah, it's the knuckles. So when you were pushing real hard, right, you were Wolverining.
That's actually exactly where it was.
Right,
yeah.
where you were Wolverining, like, you
Yeah.
were pushing, and then it pushed out these ribs.
Pushed them out.
Well, it displaced them, what we call subluxated them outwards, right? You know, you were pushing forward, and then was that laws of thermodynamics, right? For every reaction, there's equal and opposite reactions, right? So you're pushing forward, and the ribs are having to
Push myself
they're
out.
going backwards.
So it was like the joint got inflamed,
Right,
basically?
right, that's
So
right.
not a nerve that time?
Yeah, so it's not, yeah.
Well, the joint, there's nerves in the joint.
Okay.
So the nerve endings in the joint got inflamed. So it's
So what's the difference between that and a pinched nerve?
so typically when we say pinched nerve, what we mean is the all right, side detour. So when you look up for a second, usually when we mean a pinched nerve, we're talking about a wire leaving your spinal column getting influenced by a disc injury. So either a bone spur or a disc is hitting the wire. And it's never direct contact. There's always the disc putting pressure on tissue, which is putting pressure on the nerve. That's what we call a pinched nerve. The joint is where the vertebrae are connecting to each other, and there's nerve endings inside that. This is a capsule here. There's ligaments that hold that together, and there's nerve endings in there. Now, yours are more specifically up here on this model is obviously missing the ribs that attach to these transverse processes. So right in these rib heads, this is where the nerve is irritated inside that joint. There's a rib attaching here. If you hit this wire, it would have shot around to the front of your body.
It would have been like, yo!
Right. Yo! So, yeah, it's that area in the middle back is also a very, very uncommon area to have any disc injury. So it's
Up top?
up here. Yeah, you don't.
Really?
Almost all disc injury typically happens in the lower neck and lower back, and this has to do with this area quitting because of this type of injury that you had. Then leads to the discs aging here and here, and these are kind of the old person pains, right? Sciatica,
Your neck and your
and
back.
the neck and arm, right? Those middle back pains are what I call more younger people pains. They're the causes of those problems if left untreated. I got you. Take a deep breath in for me. Try to relax your back as best you can, and then exhale. Here we go, coming up. Yeah, there we go. Breathe. I got you, bud. Exhale. Breathe. Exhale. Good. All right, we're done. All right, arms down for me. Yeah, there we go. There we go. All right. Ooh, yeah. Okay. Come here. Bend your knees for me. All right. You're gonna press out. Press out your knees. Hard as you can, and now relax. Now relax. Okay. Now, try to squeeze your knees together. Squeeze your knees together.
Oh.
Okay. Not so sure about that one, Ed.
I don't know about that one. Oh, it feels funny.
Lean back for me, lean back a little bit for me. There we go. This feels good. Relax your arm, I got you.
Ooh.
Okay, good. Put your hand on your hip for me. Just put your hand like that. There you go. Look straight forward for me. Now press back with your elbow a little bit. Press back. There you go. Yeah. That.
Ooh.
Lean back a little bit for me. For me. There we go. Okay. Press back with your elbow a little bit. There you go. Nice.
That's interesting. Oh, God.
Oh no. Tilt your head right for me a little bit. Okay, good. Yeah. Tilt your head right, tilt right. Okay. Go ahead and tilt left for me, tilt left. Okay, okay. All right. Go ahead and tilt left for me, tilt left. Okay.
Ooh.
Your treatment is to have your head back over it. Take your left hand on your forehead and place your hand and you press. Try to get your head to go into it and then maybe a little bit of left. Make sense? You want to get a little more pressure on that left side to work that knot. Make sense? And then see if your head will stay there and you put your hand back down and relax. Just like that. 20 minutes. You just kind of go home. Maybe the TV's to your left, you know? That'd be the way to remind yourself. But this is end of the day, half hour for you to bed. This is how you keep the tension from reaccumulating in there. And then my sister has these kind of rollers. You know, she sells these guys. I'll show you this in a second. It's pretty cool. I'm not sure if we had this last time he was here.
No.
No, they're new.
Yeah, so
Do you follow Brenda? Or okay, yeah.
So these are cool because they can get in between the shoulder blades, right where those ribs are, kind of popped out. And this you can roll around and work those ribs in the upper back. And that gives you some tools to brush your teeth. It's like a toothbrush for the vertebrae to go in there and work on them. And obviously it's not as good as my elbow, but it's the best emulation we have to give a tool that you can use at home to care for yourself. Okay, really back. I got you. Yeah, right there. You go.
Oh God.
Behind your head. There you go. Knees bent. Put the arms to the side. There you go. There we go. You kind of just every minute you kind of move 1 inch. Kind of moving up and down like a roller, a wheel, and you kind of move around. So you can go ahead and roll upwards a little bit towards me. There you go, and you kind of move down and try to find and target
Wherever I feel it.
Yeah, you want to hold pressure on it and can't take it anymore, then move up or down 1 inch. Counter stretching, it's the hours of sitting. Almost everybody in America is spending a predominant amount of time bent forward, right? How often we just don't ever spend any time. So why do I have to do 20 minutes? It's the wrong question. The question should be, how on earth can 20 minutes of arching back possibly undo 8 hours of bending forward, right? 20 minutes actually is a small amount of time considering the amount of time we spend bent forward. And the answer is because we're hopefully going to get you to go as far back as you can. And that has the capacity to balance mild flexion. We can balance it with extreme extension.